This segment is brought to you by Riceworks, the gourmet brown rice crisp, made with whole grain brown rice, with no cholesterol, no gluten, and zero trans fats, which makes it perfect for your healthy diet.
Hi everyone, I'm really excited because today's segment is going to talk about one of the most interesting diets and a disease that a lot of people are talking about, celiac disease. And what better person to have with us than one of the leading experts in this field, Shelley Case, who is a registered dietitian and in fact an author with a fantastic gluten-free healthy living book. So it's really, really exciting to have her with us today to talk about the disease, what is it, and how can we live with this disease. So welcome, Shelley.
Thank you so much for having me today.
Yes. Now, when we're talking about celiac disease, we certainly are hearing a lot about it in the media. Celebrities are talking about it. But what is celiac disease?
Well, celiac disease is an inherited autoimmune disease in which when someone consumes gluten, which is the protein found in the grains wheat, rye, and barley, it damages their small intestinal tract. And they're called these little finger-like projections called villi. And these villi are damaged from the consumption of gluten, and it leads to a whole host of symptoms.
Okay, and speaking of symptoms, as a therapist, I'm aware that they can be quite diverse because I see patients in my clinic with it. What are some of the symptoms of celiac disease?
Well, they're quite broad. There's several groups. One are the gastrointestinal symptoms, which are things like diarrhea, constipation, bloating, gas, and that's why some people are misdiagnosed with irritable bowel, because when you fluctuate between diarrhea and constipation, that's the logical disease that people are told they have. But you can also have other problems. You can have anemia, which is very common in adults, bone and joint pain, canker sores, migraines, sort of chronic fatigue like fibromyalgia symptoms. The list is just endless. You can have neuropathy, seizures, and so that's what makes celiac disease so difficult to diagnose.
So how many people suffer with this?
Well,
having those symptoms, diversity of symptoms, it's got to be difficult.
It is, and the new research shows that about 1 in 100 people have celiac disease, and yet only 5% are diagnosed. So that means 95% of the people are walking around with all these other problems, seeing many different doctors, and trying all kinds of supplements and medication to try and get better. And we did the largest study in the world here in Canada with the Canadian Celiac Association on over 2,700 adults, and we found that from the time they complained to their doctor till they were diagnosed was almost 12 years for the adults, and in the children's study it was almost a year. So people are very sick, very frustrated, and the problem is if you keep eating gluten, so if you keep eating things made from wheat, rye, or barley, and you continue not only to damage the small intestinal tract, but it can lead to osteoporosis and other malnutrition disorders, infertility in both men and women, and the one we're most concerned about is lymphoma, cancer of the gut. So we need to get people diagnosed much early, not only to prevent all those complications, but more importantly to have a much better quality of life.
Oh, absolutely. That is actually a really scary stat. Now, in terms of diagnosis, how do you get diagnosed with celiac disease?
Well, there is a blood test that can be done to look for specific antibodies to gluten in the blood. It's about 90 to 95% accurate. So it's not 100%, so we have to rely on something called the small intestinal biopsy. So what happens is you fast for 12 hours, they spray your throat with a little bit of anesthetic, they put a scope down into the stomach and into the first part of the small intestine and take biopsy samples to look at those villi to see if they're flattened. And they take about 4 to 6 samples, and if they come back flattened and the blood work is positive and you go on the gluten-free diet and the symptoms resolve, then we know you have celiac disease. But it's not that easy because in the early stages of the disease, the blood tests are often not positive, and if you don't take enough samples, biopsy samples, you can miss it because the disease is patchy. So you can have healthy villi and then flattened villi.
Right.
And so the other thing that's really important is that people don't start on the gluten-free diet before they go to see their doctor and get tested, because once you remove gluten from the diet, the blood work starts to normalize, the villi start to regenerate, and then the test will be falsely negative. So I think that's the most important message is if you think you have this disease, go get tested first before you start on the diet.
And thank you for raising that point, because we are hearing a lot of it about it in the media. And then people think you're doing the right thing by going and starting a gluten-free diet.
I can't tell you how many people contact me, email me, phone, write, and say, I've been on a gluten-free diet now for 3 or 4 months. I want to go get tested to see if I really have this and need to stick to this diet.
Right.
And then we have to put them back on a gluten challenge. And most people just will not be able to tough it out because it makes you so ill going back on gluten. So the the key is really to get tested first.
Right. Now, can you also have a sensitivity to gluten but not actually have celiac disease?
Yes, you can, and we're just starting to do a little bit more research in this area. Now, you can still have similar gastrointestinal symptoms, so it might be bloating, pain, abdominal pain, gas, diarrhea, or constipation. But the villi are not damaged from the gluten, so it's not an autoimmune reaction, but it's a sensitivity. And nevertheless, you still feel not well eating gluten, so you eliminate it, but you don't develop things like the anemia or the risk for cancer or osteoporosis. But it's hard to differentiate for a lot of people. And so if you've already gone gluten-free, you may, and you don't want to do the testing, you're left with,
You don't really know.
You don't really know.
Right.
So, but the thing is that if you have celiac disease, you must follow the gluten-free diet 100%, because even small amounts of gluten can keep the autoimmune process going. So gluten sensitivity, celiac disease, a little bit challenging. But
right. Now, what about wheat? Where does that fit in?
well, there are, of the top 8 allergens, wheat is one of them. So you could have a wheat allergy. Now, you wouldn't have to eliminate rye or barley, because those are the other gluten-containing grains. You would just strictly have to avoid wheat. So if you had a wheat allergy and you bought a gluten-free food, you know you'd be okay, because it's definitely doesn't have any wheat in it. Right. Now, this, an allergy is different. When you eat something with the allergen, it causes the body to develop something called immunoglobulin E. It's a type of an antibody that then triggers certain cells in the body to release these wonderful inflammatory chemicals that cause everything from difficulty breathing, runny eyes, runny nose, coughing, gut problems, even anaphylaxis, where the person, they can die from a food allergy. But celiac disease is not a food allergy. It's an autoimmune, genetically based disorder, and you must strictly eliminate all forms of gluten.
Well, as I said at the top of the segment, you are one of the leading experts, so we're thrilled to have you. And thank goodness you wrote this fantastic book, because once you do have a diagnosis, and then we have to live with it day in and day out, like going to a restaurant. Can you tell us a little bit about your book, why you wrote it, and how this is going to help our viewers if they, in fact, they do have celiac disease?
Well, as a dietitian, I've been working for over 25 years in this area, and people asked me about 10 years ago, we're always asking for what foods can I eat, what's safe, how do I know when I pick up a food label whether there's hidden gluten, can you give me recipes, what are these other grains, and can you tell me the names of gluten-free products? Right. And so that was sort of the birth of the idea of writing the book, and this is actually the 4th edition. Oh. It's a national bestseller in North America, and people refer to it as a gluten-free Bible. So I have a lot of products in there. I keep the number of gluten-free products just keeps growing by days. Every day there's another 10 products that I throw in a file saying, okay, next book I have to add that. And so there are some great gluten-free products for people to
Fantastic. Well, replace. I know, and I just came upon a gluten-free product myself just because my kids loved it, Riceworks. Now, I know as a dietitian you love this product as well. They happen to be a sponsor on our show, and I'm thrilled about that because my kids love them. They taste great. But from your perspective as a dietitian and as an expert in celiac disease, why do you find this product so great?
Well, if you think about it, the typical snack foods that people grab, they might want to do potato chips, and many of them are flavored and have wheat seasonings in it. The various snack bars, cookies, muffins, all those, you can't eat those because they've got gluten. So if you're looking for something that you want to eat on the run, the Riceworks Gourmet Brown Rice Crisps are a great product because they're gluten-free, of course, so that helps for everybody that has wheat sensitivity, celiac disease, or a wheat allergy. They're low in saturated fat. They don't have any preservatives or flavorings or colorings, and they've got 2 grams of fiber per serving and 3 grams of protein. So a great snack for someone. It's got the whole grain stamp there, so I like them too. I like to eat a lot of them because they're very addicting.
Well, there's 6 flavors, right?
Yes.
And we can just eat them on the go.
And that's the other thing mentioning about the flavoring. A lot of other snack foods, when they make a flavoring or seasoning blend, and here's a good example of a potato chip, and you can see on the list here, it shows hydrolyzed soy and corn protein. Those are okay. But then it lists Worcestershire sauce solids. And here we have a bottle of Worcestershire sauce. And if you notice on the label here, it says malt vinegar. And malt is made from barley. Right. And so that has to be avoided. So a lot of your seasoned snack foods and things will have some of these gluten-containing ingredients, which are off.
They're hidden.
They're hidden, or people don't know about it. So you really have to be a label reader, and that's why in my book I help give you detailed information about what's allowed, what's not allowed, the labeling laws and ingredients, where you might find hidden glutens, and so it's a real help for people.
Well, thank you so much, Shelley. I know next week you're coming back, and thank heaven, so that you can actually walk us through what are some of the foods that we can eat if we have celiac disease. What are some of those things to be cautious of and be aware of? And already you've enlightened us, so thank you so much. I can't wait to do another segment with you.
Look forward to coming back next week.
Thank you. So for everyone interested, Riceworks not only wants to celebrate the goodness in their product, but they want to celebrate the goodness in our communities, and they want to highlight and have you vote for a charity of your choice. It could be a known charity, a national charity, a local charity, or maybe it's even just a local church fundraiser. They want to give a share of $30,000 to the company or to the charity that we vote on. We're going to have a panel of votes. So you want to go to showusyourgoodness.com and vote for your favorite charity, or to put your charity on there so that we can vote on it. And of course, if you'd like some more information about recipes or what we've talked about, you can go to riceworks.ca. But be sure to go to showusyourgoodness.com and cast your vote, or put your favorite charity on there so that we can vote too. If you have any health and wellness questions, don't hesitate to contact me at Margaret@reallifeoncts.com.